Hi there. Welcome back. It's me, Reena B. Patel, and I'm here to share and talk about an important topic that's very relevant for us as parents and educators, and that's children and their worries. Anxiety behaviors, worry thoughts. I want to share with you another acronym that I use in my trainings. It's called S.T.O.P, and the S in S.T.O.P is the very first recommendation I make is as parents and educators and fellow therapists. We need to stop and listen and validate our children's concerns, the worries that they have, and not to dismiss them, not to just give a blanket response that it'll be okay, that it's not relevant, that it's not important. So stop and listen for the S. The T stands for talking about that thought or worry that they have, letting them talk about it verbally or for younger children through art, and having them share, and for you as parents and educators to have them almost like a bubble in their mind, the thought process, and have them visualize what we know as an irrational thought, and have them describe that to you. And then right next to that thought bubble, have them create another one that shows the similar situation or that same worry, but in a more rational way. And this is what we can do even as an exercise, so it doesn't have to be during the moment that they're having a worry. But the goal is to help them identify the irrational versus rational thinking. And next in S.T.O.P is the O. And the O is about organizing and helping our children organize the steps, the baby steps that they're going to take to problem solving the situation. Oftentimes we jump in and try to problem solve for them, or try to jump in, and it's really takes some steps to get there. And eliminating or decreasing worry thoughts and anxiety doesn't happen overnight. It is practice. I use a lot of in my own sessions, cognitive behavioral therapy, and in my book, Winnie Her Worries, which I will share with you in a few minutes, really breaks it down and makes it easy for all of us as parents to implement and use, because it's so effective. It's empirically supported. So the O is really organizing steps, taking those baby steps and helping them plan out how are they going to get there, to decreasing and getting rid of some of those worries. And then the P, the very important, the most important process in my acronym S.T.O.P is practice. You have to practice these coping skills and these techniques, and you need to practice them when you are not in that moment, because it's hard when your heart rate's racing and you have all these somatic complaints such as tummy aches, headaches, to try something that you haven't tried before. So definitely want to practice these tips prior to a situation. So here's my book, Winnie and Her Worries, and you can purchase it on Amazon. You can find out more about the specific tips that I recommend using when our children do have worries and present with anxiety behaviors. It's a great book that shares a story about a child, Winnie, who is experiencing some of these everyday worries that our children do have. And at the end of the book, I have some professional tips that are effective, that I've tried professionally and also personally as a parent of 3 myself. And you can purchase these on Amazon. I highly recommend trying these techniques out and letting me know also how it's going. You can follow me on Instagram at Reena B. Patel, or check out my website at reenabpatel.com. I look forward to seeing you soon. Bye-bye. Take care.